Welcome back to part 21 of How to Cope with Cancer by Infinite Motive. Today's topic is temperature. Temperature is going to be a big factor for, I would think, most cancer treatments. I know for sure I obviously had acute myeloid leukemia. I would assume other blood cancers follow this pretty closely, if not all. And that would be that 100.4 is the temperature that means you go straight to the hospital. No ifs, ands, or buts. That's when you head there. I'm sure, like me, many are reluctant to immediately pack up all your things, especially if you're finally getting a break from an inpatient stay, finally getting to rest at home, and now you have a little temperature, and the last thing you want to do is head back to the hospital for another long stay. That being said, it's not something to play around with. A temperature at 100.4 could spike very quickly. It's happened to me in a matter of 20 minutes, going from feeling normal to having a little temperature to shaking uncontrollably. It's not something to wait around on. I do encourage you to obviously check the temperature multiple times to make sure that it's a real reading, but outside of that, it's urgent and you need to make it to the hospital. Always have I would assume if you're going through inpatient stays, you kind of have a go bag already ready to go from just experiencing this, but have a bag packed that's ready for a somewhat longer stay with all your necessities, because who knows, you might be going and you might be staying inpatient for the next 2 weeks from an infection. It's happened to me, I'm sure it's happened to many others. And the other aspect of it is that when you have a temperature like that and you come in, there's no guarantee that there's hospital beds available. There's no guarantee that it's not a busy night and they don't have a ton of people in the hospital waiting. And as much as they do expedite it for higher risk patients, it's still a process. And if you're vomiting, having stomach issues, shaking, all of this is going to have to be dealt with in the waiting room until they can get you a bed. And I can tell you it's not worth waiting on your temperature to go back down just to end up going to the hospital, having to get on all fours on a hospital gurney to give them a urine sample while you're shaking uncontrollably. It's not fun and it can be avoidable. It should be no question that once you see that temperature, you know it's time to go. It's unfortunately something that can really bring you down, because if you're looking forward to your time off at home from treatment, you could potentially be back for a long stay. But it's much better to be safe than sorry. Heading back to the hospital, you'll get the fluids you need. They'll make sure that they can control the temperature and get ahead of any infection that has started. That's part 21 of How to Cope with Cancer. I hope you guys are following along, enjoying the information, finding it useful. Give us a like, a share, a follow, comment on the posts. Follow us on infinite.motive on Instagram, Infinite Motive Official on YouTube, and I'll see you guys for the next part. Thanks a lot.